Hello everybody, my name is Kelly Mitchell and today I will be talking about the problem of pediatric obesity. Now for my integrative review, I focused on pediatric obesity and motivational interviewing as the main intervention for this. Now the problem with pediatric obesity is that the rates are on the rise. And with the alarming rates growing, there needs to be something done, such as an intervention or a treatment to help decrease the number of children seen with obesity or that are overweight. Now, to focus on the intervention of motivational interviewing, I first searched many databases to find out what interventions have been studied on pediatric obesity, and that is where I came up with motivational interviewing. And I found a few studies on this that will help support the evidence that it can help decrease BMI in children. One study done in 2013 found that nearly 10% of school-age children worldwide are considered overweight or obese. And the second bit of evidence I found was from a website that did a study on pediatric obesity, and they found that nearly 1 in 3 children in America are overweight. And these two bits of supporting evidence have been studied, and they do support the fact that something needs to be done about pediatric obesity and interventions need to be put into place. Now, one way we can put in new interventions is by first looking at primary care providers. And primary care providers do play a major role in the prevention and treatment of childhood obesity. To help support the intervention of motivational interviewing, I found 2 studies that both involve pediatric patients and the intervention of motivational interviewing on body mass index. The first study found is titled Motivational Interviewing as a Way to Promote Physical Activity in Obese Adolescents. Now this study was a randomized controlled trial, which means that they randomized the population, which was 62 obese adolescents that were referred by their primary care provider for obesity in a French hospital, and this was done over a 2-year period. And all of these adolescents were then randomly split into either 2 groups. The first group was the control group, which just received a standard weight loss program, and the second group, which was the experimental group, received motivational interviewing by primary care providers as well as the standard weight loss program. What they focused on in this study was physical activity, autonomy, physical competence, physical motivations, and BMI. Now these were all measured to find out if motivational interviewing did have an impact on any of them. And one of their results was that in the experimental group, they had a significant decrease in BMI. Now this BMI was found to be statistically significant, and they also found that in this group that they had a greater physical activity participation, a greater motivation to perform the physical activity, and an increase in length and energy expenditure over time. Now this study does provide us with some good results as to how motivational interviewing does impact BMI as well as the many motivations of physical activity. And with that, we will now talk about the second study. It's titled Motivational Interviewing and Dietary Counseling for Obesity in Primary Care. Now this study was a cluster randomized controlled trial, which means there was 3 different groups that the 645 obese children could have been randomized to. Now in this trial, they were actually focused on the parents. So the parents did receive the interventions and they based it off of the children's BMIs at the end. So of the 645 obese children, they randomized them into 3 different groups. Now, the first group received usual care by their primary care provider. The second group received motivational interviewing by a doctor. And in the third group, the children received motivational interviewing by registered dietitians as well as primary care providers. So that's where this one is different from the second group. Now, the results of this study, they found that in group 3, which was the registered dietitian and the doctor, they found that there was a significantly lower BMI than the usual group, and this was found to be statistically significant. Whereas in the second group, which was the group that just received motivational interviewing by the primary care physician, they did find that there was a better BMI than the control group, but it was not statistically significant. Now, with these studies, we can conclude that motivational interviewing can be used as a good intervention for the pediatric obese patient. As for improving nursing practice, motivational interviewing can be used to do so. And by allowing nurses, such as registered nurses or more like advanced practice nurses, to perform this motivational interviewing, we can overall improve the quality of care in the primary care setting as well as the pediatric care setting, and it will create better access to care for these individuals. It will allow more providers to care for these patients in a more efficient way. And motivational interviewing is a good non-pharmacological approach to decreasing the rate of obesity in children. One area of nursing that I believe can benefit the most from the implementation of motivational interviewing is in the primary care setting. And due to the increase in number of nurse practitioners in the primary care setting, I believe that if motivational interviewing was implemented and used in this practice, that there would be a more widespread use of the intervention on obese children. And another impact of implementing motivational interviewing in the primary care setting is that it will have a positive impact on the healthy lifestyles of children. Now, the last benefit of this implementation is that we'll see a decrease in the number of obese children. To wrap things up, I'd just like to remind you that childhood obesity is a problem, and interventions and treatments do need to be put into place to help decrease this rise in childhood obesity. And with the help of these studies, I found evidence that motivational interviewing is a good intervention that should be put into place in many areas of care